To conclude this small segment, we'll show you a biopsy that's not quite as abundant, just so that you can see that sometimes examining SpiraBrush samples can be a little bit tricky, as can be examining any sample such as an ECC or a small cervical biopsy. And here's a SpiraBrush sample that fits into a low power field. Notice that despite the fact that it fits in a low power field, the sample is quite rich with epithelium. There's not a lot of fibrin, there's not a lot of blood. And as we go to a higher magnification, we can see that in fact, even though it's a small sample, it contains quite a few epithelial fragments. Over here we have beautiful, normal squamous epithelium. And again, the presence of this superficial normal squamous epithelium just indicates normal areas of the cervix. Even though you don't go down to basement membrane, the presence of normal surface are quite diagnostic of normal. So having this would be a diagnostic of normal. As we scan, however, we can see these small pieces of squamous epithelium that are somewhat darker. And in this particular level, these pieces may not be entirely diagnostic. Here we have a piece that's a little larger, and as we go into a higher magnification, we can see that some of the cells are hyperchromatic, but again, not very diagnostic of a CIN. For this reason, this is the main reason why when we obtain cervical SpiraBrush samples, we insist on getting deeper sections, and that is because in other levels, these fragments will in fact become quite diagnostic and present us with some cells that are again binucleated and have irregular nuclear contours, and these cell fragments become diagnostic of CIN. As we go from deeper to deeper, or from section to section, the abnormality waxes and wanes so that we can in fact make a diagnosis of CIN1 in this particular fragment based on this particular section. And again, in difficult samples, one can apply immunohistochemistry to these slides, and applying stains such as Ki67 and P16 have been validated in our lab, and in fact are very helpful in cases where one has the differential diagnosis of atypical metaplasia versus CIN. There are SpiraBrush samples that are completely normal, and one should become quite familiar with those. And normal samples will in fact have beautiful squamous epithelium. It'll have the presence of normal endocervical cells, and it can have fragments that contain squamous metaplasia. This is a beautiful area, or these are beautiful areas of normal squamous epithelium. The nuclei are small, centrally located, and even upon very careful scrutiny, the nuclear membranes are smooth. The chromatin is evenly distributed, and it reassures us that these are completely normal cells. The endocervical samples fragments are also benign, and of course we have pieces of squamous metaplastic epithelium, which again can have some intercellular variability, but have the characteristic flow of squamous metaplasia. It has intercellular junctions, just as squamous metaplastic cells are expected to have, and no mitotic activity whatsoever. So a nice normal sample in a SpiraBrush specimen. As with all cases, there will be some samples received in your laboratory that are unsatisfactory, and we all have our threshold for unsatisfactory samples. In a sample such as this one, where the predominance of the material is blood and fibrin, one has to let the clinician know that this sample contains very, very small or sparse epithelial fragments, and that the sample is not diagnostic and probably was not taken with sufficient pressure, and did not yield diagnostic material. And it is important to notify the clinician that their biopsy specimen did not yield a sufficiently adequate sample. Examination of these specimens is quite easy. Again, as an experienced pathologist, I equate it most with examining an endocervical curettage specimen. And as such, one has to have care to make sure that we examine the entire sample and make sure that we don't miss epithelial fragments that are diagnostic. Again, in this instance, the sample is small, but the pieces of epithelium are quite good. And again, we have here a sample with metaplastic epithelium, and this is again another normal sample. The learning curve is quite steep, and one gets used to these samples quite readily, and the diagnosis on these SpiraBrush samples can reach identical levels to diagnoses in biopsy specimens, so that in a laboratory, most of the SpiraBrush samples should be diagnostic and not equivocal in any nature. So in summary, SpiraBrush CX has been approved as an equivalent instrument to sample the cervix for the detection of cervical cancer precursor lesions. It provides distinct advantages to the over the cervical punch biopsy, that is, reduced pain and reduced bleeding for the patient, reduced time in obtaining the specimen by the physician in that they don't have to fuss around with hemostasis. And at the laboratory level, the sample is easily processed just like an endocervical curating sample and diagnosed with equal efficacy as demonstrated by the clinical trials supporting this product. It is, in my opinion, a clear-cut advantage to use the SpiraBrush. It provides equivalent diagnoses with greater comfort for the patient and satisfaction from clinician and patient alike is what we're all looking for.